Item of business this afternoon is topical questions, and our first question is from Neil Findlay.
To ask the Scottish Government for what reason it is allowing the discharge of COVID-19 positive hospital patients to care homes.
Cabinet Secretary Jean Freeman.
COVID-19 positive patients are not routinely being discharged to care homes in a very small number of exceptional cases, and only where a clinician has judged that this is in the best interest for the care of their patient. Discharge without a negative test can only be undertaken where steps including clinical risk assessment are undertaken. The Scottish Government's guidance issued in May states, and I quote, "Residents being admitted to a care home should have a negative test before admission unless it is in the clinical interest of the person to be moved, and then only after a full risk assessment." The policy has not changed. The Public Health Scotland guidance issued in October mirrors this, stating, and I quote, "The presumption should be that residents being admitted to a care home should have a consented PCR COVID test before or on admission, unless it is in the clinical interest of the person to be moved, and a risk assessment can support this. Local health protection teams can advise in more complex situations."
Neil Findlay.
Presiding Officer, last Tuesday my constituent was admitted to hospital from her care home. She tested positive for COVID on Wednesday and was discharged back to the care home on Thursday. When I raised this at FMQs and asked if we were back to discharging COVID-positive patients to care homes, Nicola Sturgeon was emphatic in her answer, saying, and I quote, "With respect, I do not accept that. There is no such policy and there will not be one." In a previous parliamentary answer to Miles Briggs about care home discharge, the Cabinet Secretary said, "No one should be discharged from hospital who has a positive test for COVID-19. If they are in hospital, they should remain there and be treated for the virus." Another emphatic answer with no caveats. Since Thursday, I've spoken to families, care staff and a care home manager from another establishment. All have told me of cases of COVID-positive hospital discharges to care homes taking place that are not end-of-life cases and where no or a very limited risk assessment has been carried out. I've also been advised by care home staff that they are being repeatedly asked to accept COVID-positive patients with no negative test and told just to isolate them for 14 days instead. So did the First Minister mislead Parliament on Thursday, or did she not know what her own government guidance was?
Cabinet Secretary.
So neither the First Minister nor I have misled Parliament. The guidance has been clear. I've read it out, the relevant section from May, the guidance issued in May, and the Public Health Scotland guidance issued in October, both of which include that exception in exceptional circumstances based on clinical judgment. And as I've said here in this chamber before, and I will repeat, I think it is entirely the right position to have in this instance, as in other instances of medical care, that we allow doctors, on the basis of their clinical knowledge of the patient, their experience, their expertise, their many years of training, to exercise clinical judgment. And I do not think it would be right for a politician, this politician or any politician of any stripe, to take away that capacity of clinicians to exercise clinical judgment. The guidance has been clear, and there is also detailed guidance with respect to those exceptional circumstances, which say, and I will give it in detail, clinicians will consult the patient, if possible, their family and care home, on what is in the patient's clinical interests. A full risk assessment would be carried out on any transfer. Appropriate mitigation actions and support will be put in place. A 14-day period of isolation must be completed in all circumstances. The risk assessment that is carried out would consider specifically whether the care home was able to support this isolation period. That's a 14-day isolation period. A care plan for the completion of the isolation period will also be required. All of that is clear. It's clear in the guidance, and what we really need to understand is that nothing has changed since we introduced the requirements for testing before patients or residents were admitted to care homes, be it from hospital or be it from the community. But it is not the role of ministers, nor should it be, to take individual discharge decisions. That is entirely properly the role of doctors and others in the clinical team.
Neil Findlay.
Well, it appears that across the country these guidelines are being repeatedly flouted. But can I ask this? What about the rights of the other care home residents, Cabinet Secretary? Because the guidance says visiting should only take place when care homes are established and declared free of COVID cases by local health protection teams 28 days from the last positive test. The Cabinet Secretary knows only too well of the anguish of residents and their families who cannot be visited and cannot see their loved ones. And yet this guidance builds in further isolation and entrenches isolation from family, because if you put someone back into the home who's COVID positive, there is then a 28-day period when they have no visitors. So what about the rights of the existing care home residents and their families to have connection and see each other?
Cabinet Secretary.
Say two things in response to that. If Mr Findlay has evidence that the guidelines and the protocol that I have just read out in summary is being flouted, then I would want to have that evidence and investigate those matters, as we did in the case of the constituent that he raised at First Minister's questions, and he will have had the response from me on that, explaining what happened in that situation. In terms of the 28-day period, he is correct. Residents and care home relatives have raised this with me. Indeed, this morning, so too did colleagues who are chief officers of health and social care partnerships raise that issue with me. And I'm happy to inform the Chamber that our chief medical officer is leading a discussion with clinicians to see if it is possible and safely, given what we know in the developing knowledge on the epidemiology of this virus, whether it is possible to safely reduce that length of time. Depending on that advice, then I will act, but I will not act in defiance of clinical advice.
Emma Harper, to be followed by Donald Cameron.
The Cabinet Secretary touched on this in her response. However, I think it's worth emphasising the importance of clinical expertise and that discharge decisions have been made and must continue to be led by clinicians deciding on the best care option for each individual. Can the Cabinet Secretary expand on some of the factors that clinicians have to take into consideration? And I remind Chamber that I am a registered nurse.
Cabinet Secretary.
So I'm grateful to Ms Harper for her question. It is entirely proper, as she said, that doctors and clinical teams are charged with making these decisions. They make these kind of decisions and judgments every day, and no one should underestimate how difficult it is for them in many circumstances. However, the kind of exceptional circumstances where they would be considering this position is, for example, where an individual cannot actually take the test because it would be too distressing, and that's the clinical judgment, too distressing for them to take that test, but it is no longer necessary for them, for clinical care, for them to stay in the hospital. It may be that the individual has reached the end of their life and it is determined that the place where they would want to go, this may be their expressed wish, it may be the expressed wish of their family, remembering that those conversations have to take place, is that they are discharged home with appropriate palliative care or to a care home with appropriate palliative care. Remember too that whilst testing is really important, there are a range of other important infection prevention and control measures that care homes undertake and put a great deal of time and effort into undertaking in order to ensure that their residents are cared for as well as they can, and that they do everything they can to prevent the transmission of the virus within a care home. That includes the staff testing that we undertake, and I hope members will also be relieved and pleased with some of the additional measures I shall speak about tomorrow in my statement on testing.
And Donald Cameron.
Thank you. A few weeks ago, this Parliament voted for the Scottish Government to hold a public inquiry into care home deaths at once. Rather than delay things further by waiting to hear back from other UK nations, will the Cabinet Secretary now respect the will of Parliament and commit this Government to holding its own public inquiry immediately?
Cabinet Secretary.
I would never disrespect the will of this Parliament, as I think I've explained to individual members. I have sought to see if it is possible to have a public inquiry that is, at least in part, rests on 4 nations. I think that makes a great deal of sense. I regret I've not had a response. So we will now begin the steps, but members should not be under any illusion that it is a quick exercise to set up a public inquiry. There are significant steps that need to be undertaken that involve the Lord President, the Lord Advocate and others, and we will undertake those steps as we continue to deliver a vaccine programme, an enhanced testing programme, support our NHS and social care to deal with the level of virus prevalence and cases that threaten our citizens across Scotland every single day.
Thank you. Question to Rachel Hamilton.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on any relaxation of restrictions over the Christmas period.
Cabinet Secretary John Swinney.
Presiding Officer, the Scottish Government has been discussing a slight and careful easing of measures for a few days over the festive period with counterparts in the United Kingdom Government, the Welsh Government and the Northern Ireland Executive. The Scottish Government's proposed approach is still to be finalised, and the First Minister will take part in discussions on a 4 nations basis later this afternoon. We hope to reach an agreement in principle across the 4 nations that will allow people to travel to spend time with friends and family and for a short period over Christmas. We are considering this because we recognise that isolation and loneliness can hit people particularly hard over the Christmas period. Of course, any relaxation carries with it a level of transmission risk, and when we set out the rules that will apply over this period, we will be asking people to think very carefully about what they can do to limit their social interactions and the opportunity the virus has to spread.
Rachel Hamilton.
I thank the Deputy First Minister for that answer. We all agree that whilst people are looking forward to celebrating Christmas, we must do so carefully given the pandemic is still with us. Throughout the past 8 months, we have had to balance the risk of the virus with the impact of social isolation and loneliness. A British Red Cross report found that sadly 32% of UK adults worry something will happen to them and no one will notice. We cannot let this happen over Christmas. And over the festive period, would the Deputy First Minister agree with me that this balance is more important than ever, especially for people who haven't seen their family in months?
Deputy First Minister.
These are all entirely understandable and significant issues. There are, as we have rehearsed in this chamber on a consistent basis over the last 8 months, there are many competing pressures and risks in the handling of coronavirus. There is the immediate health risk that is faced by individuals as a consequence of the virus, but there are the implications of isolation which can affect individuals. There are the issues of economic loss and social harm and social well-being. So these issues are all considered by the Government. That thinking will be brought to bear in the judgments that we make at Christmas time. But what I would be very clear with Parliament about is that we are talking about here a very limited relaxation of restrictions to make sure that we do not in any way fuel the spread of the virus. Obviously, any amount of human interaction helps to spread the virus. It's the nature of the virus, but we will be trying to minimise that in the advice that we give out based on the decisions that we take.
Rachel Hamilton.
To ensure as many people as possible can see their family, we need a four-nation approach. It's vital that there is a coherent set of rules across the United Kingdom so people can have the confidence that they can celebrate Christmas safely. We must ensure people understand the risks and the trade-offs. Will the Deputy First Minister indicate if the forthcoming details will include information on any subsequent restrictions in January?
Deputy First Minister.
I think what we're trying to do here is to operate on a four nations basis in the Christmas period, because we recognise the fact that families are spread right across the United Kingdom, and we have to have coherent arrangements in place to enable people to interact. It is important, however, I think, to stress that where individuals come to as part of the Christmas period, they will have to follow the rules in that locality. And that certainly will be the insistence of the Scottish Government as to whatever rules pertain in an area to which people come, the rules must be followed. Obviously, any subsequent decisions in the aftermath of the Christmas period will be judgments for each part of the United Kingdom to take forward, as we have done so far. This Government has taken a set of steps which have resulted in a reduction in the prevalence of coronavirus over recent weeks. We took some more significant decisions just last week, and we will continue to monitor the effect of those and make subsequent judgments as we see the prevalence of the virus. But the point on which I agree with Rachel Hamilton is that we must be very, very careful in whatever we do at Christmas that we do not fuel this virus.
Thank you very much, and that concludes topical questions. We're going to move on now to our next item of